This
on the
conference will now be recorded.
yeah, so I'm turned on the recording so we will be able to have a conference. All right. Now, today we're going to talk about one agency's roadmap on policy implementation. As I mentioned a few minutes ago, um, over the last 5+ years, the Bakersfield ARC has made some significant changes to the way they provide services to the individuals that they serve. And so, what I want to do is I want to talk about where they started, what some of the how they went about it, some of the things that went well, some of the things that didn't go so well, and what's sort of the future looks like. So it's again one agency, and this might not work for all of you, but we could take a look. Um, the rules of this webinar are that you need to attend the entire webinar to get credit, and you can get today. It's anticipated that we will go 1.5 hours. And during that, if you stay on for the whole 1.5 hours, you will get credit for that time. And that credit can be used with both community care licensing and with Kern Regional Center for your CEU requirements. So um, stay with the class and you'll get credit. You must identify yourself at the beginning of the presentation on the screen or in the chat. I see all of you are identified, so you've done that. If one or more persons, if you've got more than one person sitting there in front of the screen, please identify everyone that's watching this webinar so that we can make sure we get credit for everyone. So that if because all we're going to do is go with the one name we see on there if we don't know that there are others taking it. Okay. You must send to Irene over at Bakersfield ARC after this course is over a brief. It can be 3 bullet points. Doesn't have to be a very detailed explanation, but what you learned today. So, what did you 3 points that you learned as the things that you learned? Two reasons for doing that. One is we want to make sure that you were on the conference the whole time. Most of you have your uh, cameras off, which is okay, but we do want to make sure you are actually listening and hopefully benefiting from this. Uh, and then two, we want to one of the things that we've learned over the years is that uh, adult learning is that such that if you write it down, it tends to stick better and you remember it and it has more impact on the work that you do if you actually write down. And so, some people take notes, but you don't need to take notes, but do write down 3 things during the time that you're on this of things that you learned today and submit that to Irene. Valerie just put in the chat Irene's information, and you just send to her 3 bullet points saying, "Hey, I took the roadmap class, today, the 27th of August, and I would like my hour-and-a-half credit." And she will send you a certificate for your electronically with your 1.5 hours of credit. So please take care of that. And then finally, we do ask that you submit your credit request within the next 30 days. It just makes it a lot easier for us. And then you also get your credit sooner if you do that. So it's for just mechanical reasons, it just makes more sense. Okay. Bakersfield ARC in the grant that they have for this year. They're going to be receiving another grant, and they were going to be doing some more work in starting in October of 25, but that will be a little different. And one of the areas that they have grant money for this year, but will not have the funding for next year, is using the continuing education firm Relias. And Relias is a national organization that does a lot of training, does a lot of other areas, not only in developmental disabilities, but also mental health. They do training for a number of organizations. They have a huge catalog. Well, Bakersfield ARC went through their catalog, found 31 training classes that you can take that are self-paced. So you would get online, uh, password in, and then you could take that class. Unfortunately, like I was mentioning earlier, the funding for that expires at the end of September. So if you're at all interested in and or need additional continuing education hours, this is a good way to get it. And the one one of the many advantages that this has is that it's self-paced. So you get on when you want to get on. So if you want to, it's in the evening at home and the kids are gone to bed and you've got a few hours before you're going to bed, you can get on and take a class if you want. Once you finish the class, you take an online exam. If you get a certain competency level, then it will kick in and will allow you to take it. So you can see Valerie's information on the screen. If you contact her, she can help you with that. But again, you only have a month to really to do that. Unfortunately, we contracted with Reliance for 1 year. The year is coming to an end. So if you are interested, do it now. There is one caller I see on who, if we need to get your information, if you want continuing education credits, so please put it either on your call or put it in the chat so we know who you are and we can make sure you get credit for today's presentation.
Sorry, Jeff, just really quick. So I do see there's a few people that when it has a little phone on it, they're on the actual phone listening in. So if you would like to get CUs for what you heard today, you're going to have to unmute yourself or give us a call at the office or whatever we could do to make that happen. You'd have to just announce yourself.
All right. Yeah. We need to know who you are if you want credit. You know, I tend to think that I do a good job of what I teach and it's good training, but I also want to make sure that you get credit for listening and being involved in this process. So we want good things to happen for you. Now, Bakersfield ARC is hosting a personal outcome measure. It's called the PALM workshop in September the 15th through the 19th. It's a full week of trainings and excellent training. At the end of it, you will be certified to use the tool. And right now we're just pretty much full. We may have a couple of openings. A couple people have said that they may not be able to take it who've signed up. So if you are interested, get a hold of Valerie, the same address that you saw a minute ago in the chat, and or call her at Bakersfield ARC 834-2272. And you can see about the potential for signing up for that training. Excellent training. The Council on Quality and Leadership is one of the leading agencies in accreditation for services for persons with developmental disabilities and also mental health. And Valerie says that we need to get the last two people on by this Friday. So if you are interested, please let her know ASAP, and we can see about trying to get you into that training. Okay. Now, today what we're talking about is what the Bakersfield ARC did to make some of the changes that they made. But I want to really stress that one size does not fit all. Now, each of you come from unique organizations or residential facilities or other types of service provision, and what works for you and what worked for Bakersfield ARC may not be the same. And so I'm not trying to say this is the end all and be all and got to go this way. or if you don't go this way, you're not doing it right. There are more than one way to do this, and what we do is we want to encourage you to look at uh, the different options and figure out what works for you. Now, this is a work in progress. That the Bakersfield ARC is a not for profit, so it has a board of directors. The board of directors sort of sets a roadmap for the agency, and then the uh, executive officer and the senior managers then implement that. But when you're looking at this stuff, it's not all about the people at the top, because they can make all kinds of plans, but what do those plans really mean? And so when you're really doing it, you need to make sure that you have your middle level managers and your line staff and your community on board with what you're doing. Now, one of the things that we found at Bakersfield ARC as we started trying to implement is that some of our line staff um, weren't really all that excited about what we were attempting to do. So we were going ahead and implementing stuff, and they didn't particularly understand it, or didn't really like it, or didn't, and there was a certain amount of resistance, and we could have, in retrospect, done a better job of really getting the information out. We did have some trainings. While I was still working at Bakersfield ARC, would go around to the different uh, classrooms and work sites and other things, and would talk to the staff and would tell them, hey, wait a minute, this is a direction that we want to go in. This is and sort of made an assumption that people understood it and were on board with it. And what I found out later on was no, not everybody really fully uh, bought into the idea of community-based services or the changes that we were making, or they didn't fully understand. For example, some people liked that they would go every day to the day program, and so they would, drive to the Bakersfield ARC site there on South Union, and then they would go into their air conditioned classroom, and they would provide the services there during the day, and then in the afternoon they would drive home. And now all of a sudden they were coming, they were going to the bus barn, picking up a vehicle, driving out into the community, picking up people, taking them out to the community site for that day. And it was a very different approach to how services were delivered. And some people didn't fully understand why we made that change and why that change was important. So you need to really make sure you have all levels. Now, your middle level managers are a good place to start also, because they're the ones who are going to be talking with your direct support professionals. And so if you can get your middle level managers to fully understand why you're making the changes that you're making, and having them buy in, and then take it down to the people who are going to actually be where the rubber meets the road, both literally and figuratively if you're driving out in the community, then that really helps too. And again, this presentation is how Bakersfield ARC was attempting to meet the home and community-based waiver services. Now, I was under the understanding when these regulations first came out in 2014 and in subsequent years that the new look for the system in its entirety was going to be 100% community based, that site based services would be gone. I misunderstood. So I was pushing everybody should be out in the community at all times, and that is not what really is occurring right now throughout the system, and it is not necessarily a requirement. So, what works for your particular setting? If you still have a portion of your day being site based, that's okay. It's what you do with that. How do you make it meaningful, and how the choice that the people that you're serving make about services. Um, the changes made by each program were different on how they met community integration, choice, and privacy. So even within our setting, again, one size did not fit all. So different programs did things a little different. And again, each program had its own program manager, possibly a supervisor, and then line staff. And so they sort of decided how they wanted to implement the program for the individuals they were served. And they did that in conjunction with working with the individuals served. So talking with the people who were receiving the services and finding out for them how they wanted to receive the services. And we found there was some resistance there too from some of the individuals who we were serving. Because when we were at the site on South Union, many friendships were made. Many people had a regular social group that they were involved with. So they were taking the classes together. They were, if they were in the work area, but they had a friend who was in the classroom settings, the day program settings, they might meet at lunchtime and share and spend time together. And that sort of dissolved because when we now were doing everything out in the community, some of those relationships changed, and they weren't based on being at a site during the day. So and some people didn't understand why we needed to do that. Wait a minute, you're telling me I have choice, and I choose to want to stay on this campus. And I choose to want to be with my friends. And so why are you taking that choice away from me? So that was a challenge as well, as how do we work with people on, wait a minute, no, we're changing how we provide the services, and the choices will be different. If this is not a choice that you want to make, we can assist you and work with the regional center and your ID team on maybe finding a different provider. Where if a site based type of service model is what you really would like, as long as that is, there are available options in that area, we can help you find that. So there were a few clients or individuals who decided that no, that they didn't really like this new model, and they wanted to receive services from other community providers, and we assisted them with making that change. So it um, okay. This was the old Bakersfield ARC. Um, Many of you remember it as BARC, BARC. They don't use BARC anymore, although some of us old timers, I started in the system here locally in 1977 when Bakersfield ARC BARC was on 4th Street, which is now one of the Bakersfield Senior Center, right there on 4th off of Union Avenue. So I've known it for years, and so it was a bit of a challenge for me to change and not call it BARC anymore. But anyways, the old Bakersfield ARC, BARC's mission is to build a strong community by helping people with intellectual and developmental disabilities achieve goals for a better life. So it was helping people. It was so that our job was to help you do better. So it was a model of us sort of being in charge and moving you forward. The new logo, Bakersfield ARC, Advocacy, Respect, and Community. ARC is a national organization which actually stands for the ARC. It comes out of, it was developed in, I think, the late 50s, early 60s. Originally, it was the Association for using the R word, children, and then it changed over time to Association for the R word adults or citizens, and then finally it just became the ARC. Well, Bakersfield ARC has decided to do things a little differently, and they are calling it Advocacy, Respect, and Community. But the mission statement now reads, Bakersfield ARC provides supports and services so those we serve have the opportunity to live a life of their own choosing. So instead of us helping people so that we're there to sort of move you along, it's that we're here to provide you with support and services that you want. So you make the choice about what you would like to see, and then we'll help plug you in to that. So you're become the decision maker, and you're the one who really decides on how you would like your services to be rendered. And that's a big change. So we went from the sort of the old model. I sometimes joke, some of you may remember there was a comedy series back in the late 50s, early 60s called Father Knows Best. And that was kind of how the system worked years ago. You know, your service coordinator, back then they were called psychiatric social workers or counselors or things, would really make the decisions for you. And the day program that you went to would make the decisions for you. So if you decided that you wanted to go to a program like the old BARC, you would go there and sit down with the intake coordinator, and the intake coordinator would tell you, well, on Monday we do this, 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 and this. On Tuesday we do this, 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 and this. And so these are the classes that you will be involved with because you're, based on your cognitive skills and, your self-care skills, we're putting you into this group. And that group is doing these things on different days. And to use an analogy, it was kind of like the tail wagging the dog, that the provider was deciding on the services that the individual would receive, rather than the individual coming in and saying, hey, wait a minute, I'm interested in your program. What can you potentially offer me? These are the areas that I'd like to see. These are my strengths. These are what I'd like to learn. This is what I'd like to do in the community. And how can you help me to accomplish that? So when we sit down as a team, could we set up goals and objectives that will meet my particular hopes and dreams in terms of moving forward? Okay, the Bakersfield ARC, as it was known, was founded by a group of parents in 1949 as an alternative to institutional services. Most of you probably know that the state of the art in terms of services back in the 40s, 50s, into the late 60s and even into the early 70s was that institutional care, placing your son or daughter into a state institution was the way to go. At one time, California had almost 13,000 individuals living in, at that time they were called state hospitals. Subsequently, they became developmental centers. But there were 7 of them throughout California. There were, we think of Porterville because that's nearby, but there was a Fairview in Southern California. There was Lanterman in Pomona. There was Agnew's in San Jose. There was one in Stockton. There was Sonoma. There was a program at Napa. There was a program at Patton. There was a program at Camarillo. So there were a number of different sites throughout the state that had programs specifically to house and serve persons with intellectual disabilities. Well, some parents said, no, that's not where I want my son or daughter. I want them to be at home with me, and I want services for them. So this group of parents got together here in Bakersfield and came up with an alternative. And interesting enough, it was a collective. Parents would all be part of this. So on Tuesday, you supervised the group of individuals who were receiving services. On Thursday, I would do it, and so it was. There were no regional centers. There was no purchase of service. No service model like we know today, and they called it the Peter Pan School. Now, if you remember the story of Peter Pan, he was the child who never grew up. And that was sort of how people viewed adults with intellectual and developmental disabilities back then. So even though these parents wanted to keep their sons and daughters at home, they still viewed them as the children that never grew up. So services have grown from a parent support group, educational cooperative, to inclusive vocational day and support community services. So that's over 76 years. So the Bakersfield ARC is the longest running organization serving persons with developmental disabilities in Kern County. And actually, although they are a member of the ARC, they predate the ARC. So the Peter Pan School was there before. If some of you remember, years ago, every year at the Kern County Fair, BARC had a booth where they sold hot dogs and hamburgers and other things, a fundraiser, community awareness, and other things that they would do in the community to raise funds. Because in the early days, like I said, there were no regional centers. There was no purchase of service for any advocacy, for any case management that you provided for individuals. So today they're striving towards meaningful community services, focusing on obtaining positive personal outcomes. And that's a change over time. That when I first started, what Bakersfield ARC and other programs as well. So if you're on this call today, and I see there's some people from NAPD and MARS and other service providers, if you go back and look at what service delivery was like back in the 70s or even into the 80s, when I started in 1977, we used problem-oriented records. So what would happen is that you would write down client had nothing to do during the day. So what we were going to do was we were going to buy them a day program. And that was the objective. There were no specific objectives about what services we were going to be providing. It was just we're going to provide and then in many cases, the actual provider of the service would then write up a list of the things that they were working with this individual on. But in many cases, those were cookie cutter. Boom, boom, boom. They were more reflective of the classes that were offered during the day. So if we had a cooking class at our particular program, then from 8 to 10, we would do cooking. So there might be an objective that was for cooking. And that cooking objective would be in John's plan, it would be in Mary's plan, it would be in George's plan, it would be in Sally's plan. So it wasn't individualized. It had more to do with what the program was offering for that 2 hour block than it was for anything related to what that individual wanted for that time frame. Now, there have been a number of laws and changes over the years. Now, I didn't put them all in here. I just picked out a few that I felt were important. In I believe 99, the U.S. Supreme Court came up with a case that it was based out of Georgia, Alabama. Can't remember specifically. But that was where two individuals wanted to live in the community. And the state said, well, no, we think it's more cost effective to keep them in the institution. Now, I question that because by the time California pretty much moved everyone out of its state institutions, they have about 240 people left in California's institutions, and they're almost entirely there because they're court ordered to be there because they are considered to be not competent to stand trial, or they're a danger to self or others, or both. And but by the time those institutions were closing, it was costing almost $340,000 a year per individual. So I don't understand how it could ever be considered to be more cost effective to have somebody in the institution than it would be to have them in the community, unless you're really not, you're warehousing and not really providing services. But anyway, so the extent of this case was such that the courts came out and said, no, if somebody wants to be in the community, you have to provide that as an alternative. You can't use the excuse of it's more cost effective to do institutional care. Also, there have been a few changes that came around in 2014. There was the Work Innovation and Opportunity Act, which is a very large law that has to do with employment. And in there is a small section of this very large act that has specifically to do with disability employment. And it makes some really changes in the way, especially state departments of rehabilitation started working with young teenagers who were moving towards adulthood and were looking towards leaving the school system. And then once they left the school system, what services providers in the community would provide that individual. So that made a big change in the way services are provided. Now the Department of Rehabilitation has to spend 15% of their budget on working with high school kids or high school young adults. You can start having the Department of Rehabilitation in your education plan as young as 16. So it really is a change in the way services are being provided to youngsters looking towards work. Then many of you know that in 2014, the home and community-based waiver requirements came out. Originally were to be implemented in 2019. Then changed to 2021, then COVID changed to 2023. California asked for an extension to 2024. And here we are in 2025 when we are, in quotes, fully implementing. And I've talked with Leslie, who's on this call, and Veronica, and they've shared with me that the state's going to be coming down very shortly with some new regulations specific to how we're going to implement these regulations come the future. I'm sorry, there must be something that's setting my dog off. Just give me 1 second here. Okay, so the Latterman Act in 2012 changed also to put in. I'm sorry, I'm going to put it on hold for just 1 second. That's not acceptable. I apologize for that break. One of my neighbors is putting in some new concrete on their driveway, and he is doesn't like the change to the neighborhood, evidently. And then finally, the Lanterman Act in 2012 says, hey, California is an employment first state, so that when we're looking at someone coming out of high school and we're looking at, okay, so what sort of services should we be providing this individual subsequent to their certification of completion, their graduation, their movement out of Individuals with Disabilities Education Act services. And California said we want them to look at employment first. So before we look at a day program for this individual or some other type of service model for their day, we need to really look at what we can do that would be more geared towards employment. So, in essence, we really need to look at employment first. If employment isn't right for that individual, the person makes a choice that they don't want the employment, or the family and the whole team decide they want to go in a different direction, then that can be noted, and you can move in that direction. But you have to really sort of rule out employment first. And California is one of a number of states that have put employment first into their law in regards to adult services. Washington, at one point, because it's not an entitlement state, it's a state that you get services based on the plan and your eligibility and what have you, and you don't necessarily have the same level of choice that you do here in California. They at one point said, okay, the only services we'll provide for adults is work. So if you want day services, state of Washington is not going to provide those. It's changed somewhat over the years, but I remember when they first really sort of declared that they were going to be employment only. And so it was interesting times. Okay, so if you're looking at getting started, you need to set a vision. Okay, where do we want to go? There's a gentleman by the name of Stephen Covey who's written in the book 7 Habits of Effective People. And in there, one of the habits, or one of the things he talks about is begin with an end in mind. So for those of you who have flown on an airplane, which hopefully most of you have, but the captain gets on the public address system and says, "Good morning. We're flying this morning to Chicago. We're going to be obtaining an altitude of 39,000 feet. We're going to be heading in a northeasterly direction. We will be going over the Grand Canyon. For those of you sitting on the left side of the plane, you'll be able to see that, and then we'll be sort of hanging a little bit of a turn right around Denver, and then we should be getting into Chicago at 2:47, and we will be going to gate number 52. And the current weather in Chicago is 68 degrees. Okay. If the pilot got on and said to you, we're going to get up into the air and we're going to see how the wind blows and where the clouds are, and we'll sort of play it by ear, and I guess we'll get into Chicago around 3 o'clock or something around that, and we'll get back to you later on with where we're going to go and what terminal we're going to land at and what have you. You would have a lot less confidence in that pilot, in that airline, in what's going on. So when that pilot gets on and tells you right from the get-go, this is where we're going and this is how we're going to get there, that gives you a whole lot more faith in what's going to be occurring. And that's where setting the vision comes into play. So if you have a direction that you want to go in, and then you start looking at the map you're going to take, the variables that you need to address to get to that direction, it makes a huge difference. Now, in the case of Bakersfield ARC, there was an experienced management team. So altogether, the senior managers, there were 5 of us, larger organization, that had approximately 125 years of experience altogether. I think that really helped because we sort of knew what was happening. And so for those of you who have been in the system for any period of time, things have changed. And sometimes it's okay, we do it this way, and then we do it a different way, and then now we're back to doing it the way we did it 15 years ago, and we've kind of gone in a full circle. And so, many of us have experience in seeing the system from a longer view of how services were delivered in the past, what they were like 10 years ago, what they're like today. It's a very different system. I talked to one day to one of the senior members of the Department of Developmental Services, and she was telling me, she goes, it took 20 years of regional centers to reach $1 billion. 5 years later, the system was at 2 billion. 2.5 years after that, it reached 3 billion. Following year, it reached 4 billion. So, I mean, just the whole model of how we provide services and purchase of service. When I first started out, it was we probably spent more on the administration of regional center, on regional center staff, than we did on providing direct services to individuals. And that's all changed, and purchase of services changed. And now that we're going to this new rate model, that's a major change again to the quality assurance component. That's going to become part of the service delivery we make. Those are all changes. And so having experienced people on your staff really does make a difference in terms of your ability to navigate through this. At Bakersfield ARC, we also had a change in executive director. So a new director came in who had some new ideas on how to do things. The previous director was very instrumental in building the structure that Bakersfield ARC had. And so making the changes really took a director who had some different ideas about the direction for the agency. And then Bakersfield ARC also applied for a number of grants. The Department of Developmental Services through Kern Regional Center every year has provided grants specific to HCBS. And if you haven't applied for those, there's the current grant cycle is going to be starting very shortly. But if the state continues to put money into that, and we don't know what next year's budget is going to look like, I would encourage you to look at potentially applying as a source of funding to help you with making some of the changes that you can make for your particular service provider. Get other people's money to help you make some of those changes.
Hey, Jeff, I see that Leslie's hand is raised.
Okay.
I
Go ahead,
know
Leslie.
she was trying to get through. I don't know if she'll be able to unmute. She said she was going to try it.
Okay, let me see if I can unmute her. No, I don't see I can.
I see that she still has her raised hand though, so I was trying to get through. She was messaging me to try to see if her mic could go on. But I think she was having difficulties. Maybe we can get her to put it in the chat or some sort.
Let me see. Huh. I don't see I'm looking here to see if there's anything I can do.
Leslie, oh, there she is.
Yeah, I can hear you now. You're on. Well, you were.
You want to try it again, Leslie? See if you can unmute yourself. I think you remuted or you shut off the mic or some sort.
Okay.
Maybe if you want to, Leslie, go ahead and whenever you get a chance, and Jeff will just keep it moving and then just chime in whenever you do.
Okay.
We'll see if we get silence it.
Yeah. Don't know what's happening. I'm sorry. So one of the things that we did at the Bakersfield ARC was we looked at what the direction that the Department of Developmental Services was going in terms of their vision statement. What were some of the things that DDS was saying they were looking at in terms of service delivery for persons with developmental disabilities? And we sort of utilized their direction with modifications specific to our agency on how we move forward. As I was mentioning earlier, start with a vision. So what were some of the concepts that went into our vision? Okay, first one was upholding established rights. So what rights? Okay, Leslie, I think, oops, your mic went on for a second there. Okay, sorry about that. We want to make sure that in all the things that we do, we're maintaining the individual's personal rights. So kind of like what I was mentioning earlier, for those individuals who really did not like the model of and the direction that we were changes that we were making, we wanted to make sure we upheld their rights and help them find other alternatives that better suited their particular needs. Again, we want to make sure that we show dignity and respect for individuals throughout this whole process. The services that we're providing are services that they are wanting, that are meeting their hopes and dreams. So we want to make sure that we're showing that we respect them, that we're giving them dignity and treating them in the same way that you and I would like to be treated. Seeking equity. One of the big challenges that our system has and continues to have, if you go online and look at the transparency section of either developmental disabilities website, or if you can go on the Kern website, it's on there too. There are statistics that are by ethnicity, by race, by disability. There are a number of different statistical breakdowns. And for the most part, persons of color, and especially Hispanics, do not receive the same level of purchase of service dollars as Anglos do. And there are a lot of theories about what's happening there, and there's a number of different studies that have been done and are being done, and every regional center comes up with a yearly plan on how they're trying to address these equity issues. And so I would encourage you, if you're at all interested in this, is to look at those statistics and see, if there are things that within your program that you can do to make sure that the services that you're providing are equal to all members of the community that you serve. Apply person-centered practices. We want to make sure that the services that we're providing are person-centered, that we start with where the individual's at and ask them what services they want and try to develop the service model that we're going to be doing for that individual based on their hopes, dreams, desires. Enable inclusion across the services. So we want people to be out in the community, to be part of the community, to really make that a goal of the service model. And when we start thinking about what we're going to be doing out in the community, how do we make sure that we're just not out in the community? We're not just taking a group of 6 people and walking the mall, which is out in the community, but it's not inclusion. So, and then practice informed choice and self-determination. Informed choice is making sure people fully understand what they're choosing. So, as I've shared before with some of my webinars, when we first started asking individuals, where would you like to go? What would you like to do? Many said, I want to go to Walmart. I want to go to Valley Plaza. I want to go to Dollar Tree. I want to go to the Regal Cinema. So they gave us the 4 or 5 places that they knew about, that were part of their repertoire, the places where they would go. They didn't talk to us about other places in the community because they didn't know. They hadn't been exposed to that. That wasn't part of their repertoire. A number of years ago, I was looking at assisting a family with a specialized placement over in Ventura. And so we went on a pre-placement visit. And on the way back, this 14-year-old youngster asked if we could stop at the beach because he had never been to the beach before. So a 14-year-old, never been to the beach. It was a brand new experience for him. So that wasn't part of his repertoire. He had no understanding of what that was like until we stopped and spent, the time there. So we want to make sure that people have understanding of what their options are so that they can make the best choice for themselves. And sometimes that means exposing people to new opportunities and then finding out, did you like that opportunity? Did you like what we did today? Didn't like it, don't want to do it again. And then finding out what people enjoy and then including that in the repertoire of services that we provide. Self-determination, again, people making choices about what they want to do. There is now a service model that is a self-determination service model. If you're at all interested in finding out more about that, you can go to the Kern Regional Center website or the DDS website, and there's a lot of information specific to the self-determination model and how that works in terms of services. Okay, supporting the whole
So
person.
Jeff,
Yeah,
can we try Leslie again?
is she even on?
She
Oh, yes, she
is.
is. Yeah.
You want to try
Okay.
it again, Leslie? She said she was going to give you a minute to go past your slide, and I think that you're clear. Let's see if we could get her on. She wanted to chime in.
Yeah, I just sent you an unmuted request.
Doesn't appear like it's working.
Oh, there you go, Leslie.
Is it working now?
Mm-hmm.
Okay, can you guys hear me? I'm so sorry.
Yeah.
Okay, wonderful. Thank you for your patience. I've been trying to connect. My computer audio isn't working very well. So, yeah, I just wanted to interject from a lot earlier, but Jeff, I appreciate you sharing how Bakersfield ARC's flight in doing the transition from traditional service delivery on site to their efforts to meet the HCBS final rule to the furthest extent. You were one agency that really took it to heart, that joined that effort to really support our individuals to be a part of the community, just like you and I. You guys had made the attempt to fully integrate, moving from having site-based services to a percentage of your time to fully integrating it. And you guys made that grand flight. So like there was a lot of things that you guys learned in that process. And I appreciate you guys having this call today to share those efforts with the community as they are determining and seeing, okay, we are practicing site-based as well as a little bit of community integration. And our goal as a service delivery system is to support our individuals to be a part of the community as a whole. So your goals as agencies serving our individuals helps continue that effort for them to be a part of the community. So all of our goals is to one day support individuals to be included to that fullest extent. And so Bakersfield ARC did share some of the things that they've ran into, some of their challenges that they faced with that early on push for a full integrated community-based service. You guys identified many barriers, such as the individuals identifying, yeah, we want to do that, and then realizing, oh, what that actually looks like is that area where our individuals need to learn a little bit more of what that informed choice is of what the services is going to look like. And in addition, you run into the barrier and challenge of individuals identifying that they had a lot of social relationships on site that may not have been able to be captured in that transition to community-based services. So that's where you guys go out into the community. So a lot of those relationships were hard to retain because of that change of service. And so that's areas where you guys as other agencies can see in your services, how can we support our individuals to build and maintain those social relationships, whether it's in the service that you guys are offering throughout the day, or how to maintain those relationships outside of service. And this kind of reflects to what Dale and Janine had shared in the trainings that you guys, some of you guys had participated over the last 2 months or so, where they identified some of the areas of how we could support individuals best to really maximize on that inclusion and support them to be more community-based. And so that's really just integrating and maintaining those relationships further and identifying that. And it takes a planning team. And so you guys have the regional center, you guys have the family and individual to continue to have those conversations as you guys move a little bit more towards meaningful day services that really include that individual. So sorry for that spill, Jess, and interjecting. If you guys are interested in more support, Jeff had also touched a little bit earlier on the HCBS compliance funding that can be available. We have that. Bakersfield ARC has utilized that to the furthest extent in being able to offer trainings like this one and enhance their service delivery to be able to meet the areas of HCBS. So if you guys are interested, we will be sending out emails to let you guys know when that funding is available and the guidelines that DDS does provide us on how we could utilize those funds in the next coming year. So that's to come. We don't know yet when, but it'll be down the line. All right, Jeff, sorry for that interjection.
No, that's all right. Thank you for that, Leslie. I'm glad we could finally get you on. Then, okay, so we want to support the whole person. So, a lot of times people look at, okay, well, they come to our day program. So we've got them from 9 to 2, and that's it. But that person has a lot of other things going on in their life. And if they share with us or wanted our involvement or part of the ID team meeting that we're having to develop that plan, we want to look at the whole person, their health, their emotional, their social, their all of that. Emphasize prevention and preventative practices. We want to make sure that people stay healthy, that they if as we move forward and people are more involved in the community, many times people are subject to more risk. And how do we help people to make choices that are good for them? And if there is risk involved, how do we mitigate that so that we mitigate the chance that there might be something bad might happen? We want to try to prevent that if at all possible. Or if it does something bad does happen, how do we make sure it doesn't happen again to that individual or to someone else? Combining funding with financial responsibility. One of the things that we did at Bakersfield ARC was as we moved away from our site-based programming and our site-based work sites, we had some individuals who wanted to do sort of a combination program where they, and especially after COVID, when we started looking at more innovative approaches, where somebody said, okay, I would like to be on a work crew. Let's say I'm going to work out at the rest stop up in Lebec 2 days a week, but the other 3 days I'd like to go to the community integrated day services that you have. And so we worked with Regional Center on developing for some individuals a plan, an individual person-centered plan that incorporated blended funding. So, as long as we didn't do the same thing on the same day, we weren't paying for work and for day services on the same day, that's permissible. So if you're looking at some innovative things of how you can go ahead and work with that individual who's telling you that, hey, I want to be part of your program, but I'd also like this, how can you maybe integrate both, work component and a day program into the service model that you have? Okay, striving for excellence in individual experiences and outcome. We want to make sure that what we're looking at is best practices. What's good services for that individual? Transparency. We want to make sure that what we're talking about is open. It's out there. It's, people can see what we're doing. That we're not hiding things or doing things behind people's back. We want to promote and provide innovative technology. So if you have individuals who need adaptive services or there are new changes that are out there, one of the services that Bakersfield ARC uses is they've contracted with an organization that provides what they call virtual job share. And you can take somebody and go online and look at numerous types of job sites virtually. So if someone is wanting to explore what potential employment opportunities might be out there, or what they might like or what they might not like, one of the ways you can do that is with the software and taking them through tours of different types of work alternatives to find that out. So that's a technology solution to helping people get a better grasp on what they might like to do for services. So the changes we made, we closed our sheltered workshop and our site-based recycling and site-based day services. Interesting enough, when COVID first hit, and we were the main blue can recycler for the city of Bakersfield. So if you put out your blue can on Thursday morning, that would end up at Bakersfield ARC in all likelihood. There was another recycler, Metro Recycling in town, that would do some of it as well. But those trucks would hold about 9,000 pounds of recycling, and they'd bring it there, open up the back of the truck, dump it on the site, and then the individuals who were in the sheltered workshop would then be on a conveyor belt, and they would sort the different recyclable materials. And then those materials would then be baled and done whatever was needed and would then be sold to a recycler. When COVID occurred, we closed the recycling center, and initially we got, through the federal government, a paycheck protection grant, which was a program that they did during COVID, so that keep people who were now out of work because of COVID getting paid. And instead of using it for our staff, because DDS and Medicaid were still paying Bakersfield ARC to provide services through an emergency Medicaid funding alternative, we use the Paycheck Protection to continue to pay the individuals who were in the sheltered employment. So we were paying the individuals who had been on that line, who were sorting, who were now not working because we shut down the line. Well, one of the things that we found was we actually lost less money paying people not to work than we were losing when we were doing the full-on recycling. Recycling is kind of like any other commodity, like gasoline. Sometimes when there's a scarcity, the price goes up and we're paying $5 at the pump. Sometimes when there's more fuel out there and available, we're paying $3.85. And so recycling is similar. There were times when recycling it wasn't doing very well back at the beginning of the pandemic. So that also went into our thinking. Hey, wait a minute, we're losing money on this. This is not a viable way to be doing business. So, yes, indeed, we were a nonprofit, and we were all about providing services to individuals. But being a nonprofit only goes so far. If you're losing money in terms of the service, you still need to be making enough money to run the operation. And we weren't doing that. We ended up selling the 25-acre campus. There were 3 different buyers who bought the site. A trucking firm bought the area where our mechanical area. The city of Bakersfield bought the recycling center, and a group called what's the name? Well, involved with the United Farm Workers bought the main campus. And then we committed at that time to phase out all of our 14C employment. 14C is a federal program that allows providers to pay sub-minimum wage. Now, 14C requires you to do a time study on all of your people at least every 6 months to find out what their productivity is. So if my productivity at 100%, I could do sort 100 pounds an hour, and you're on that line and you can do 50 pounds an hour, you would get 50% of the wage that was paid in the community for being on that recycling line. So it was sub-minimum wage. Bakersfield ARC committed to phasing that out. Subsequently, the state of California has decided to phase it out. And so as of January 1 of this year, you cannot pay sub-minimum wage in California. The federal government under the Biden administration was moving towards not issuing any more 14C certificates. So a new program that came in and said, hey, we want to do sub-minimum wage. They weren't going to issue them the permit to be able to do that. And as services phased out, they weren't going to allow new services in. Recently, the Trump administration has decided that no, that's not a plan they want to follow, and so they're going to allow for 14C to continue in those parts of the country where it is currently operating. It is not operating in California anymore. It's been the last of the 14C providers, like I say, ended on January 1 of this year. And then we decided to restructure group employment, because if we weren't providing group employment at the site, because there was also, we did sorting boxes. So warehouses, when they got to the material that came in boxes, they then folded the boxes down. We would resort those boxes, send them back out to the warehouse, and the warehouse could reuse those boxes. So instead of continually buying or boxes, we sorted boxes. We did mailers for nonprofits. We did disassembly. There were a number of things that we did at the sheltered site. We no longer did that. All of the work that we did was now anything in the way of group employment was in the community. So gardening crews, the crews that worked at rest stops. There's a large three crews that work at the IKEA warehouse on Interstate 5 there. So there are a number of things, but they were all community based. We worked with the California Department of Water and Power for their pumping stations. And the weight stations for the state of California Department of Transportation. So a number of community-based work sites were developed. We developed the position, and this position was developed actually through the HCBS grant that we received. So when both myself and Leslie a minute ago talked about potential grants for doing HCBS programming, transition coordinator, a specific position that really was tried to help us to move from here to there within our own agency. So somebody whose job specific was to help implement that. Taylor Day, some of you may have this, or it's this program that I strongly encourage you to look at. It's a one-on-one service, and it can be up to 20 hours a week. And the Department of Developmental Services, in their rate model, has a specific rate for Kern for providing that. And if you go to the site, you can look it up and see what that is and look to see if that would work for you. But Bakersfield ARC has used that for, especially for youngsters coming out of high school, or for adults who say, hey, I would like to think about employment, but I've never done it before. How do I go about doing that? Or what's out there? Or we had a group of individuals who were in Taylor Day that we took to the Employment Training Resources Center out there on East Bell Terrace. And they took the intro class on employment. And I went out there at lunchtime and was sitting with the group and talking with them. And one of the things that they shared was, gosh, I didn't realize that there were that many jobs out there. What they knew were the jobs that their family had been involved with, or what their friends' families had been involved with. So they didn't really have a good repertoire of what employment was all about until they actually were able to go out in the community and see some of that. There's also a paid internship program. That's where you get someone into a employment situation, and through a purchase of service, the cost of their salary, their minimum wage, their benefits, their everything else that's involved with working at that site is paid for through a purchase of service through a third-party intermediary. It then becomes their employer. So they work at a company, and the whole idea is so that they can get work experience, they can learn more about work, and get very specific things of working with others, doing a specific job, changing from one task to another during the day, and hopefully at the end of that, that employer will hire them on as an employee. And even if they don't hire them on, we still have a resume that we can build for that person that talks about the employment skills that they developed over that period of time. And someone can go through paid internship more than once. And so that's one of the ways we do that. As I mentioned earlier, a hybrid day and employment services, some people now do both. They go part of the week to a day, community-based day, and part of the week they go through employment. And that's an available option. Competitive integrated employment. Competitive integrated employment is where you help someone, you find a job in the community, and maybe they have a job coach that goes out with some regularity, depending on how much extra support that individual may need. And hopefully that support phases out over time or phases down over time, but that person is now employed in the community and is integrated into a work site. And so that's another program that's available for you that you can vendor. And again, look at the rates, find out what it is to do those. we really ramped up the nonprofit volunteer work that we were doing. Volunteer work should be for nonprofits. I've not ever encouraged the use of volunteering for a company that is where you're increasing their bottom line. That's not equitable for those persons who are doing the work. A peer mentor, we hired an individual who actually worked full time out at the Amazon warehouse over there by the airport, and then would come in for a few hours every day, and would talk with individuals about what it was like to be employed, what he was, what he did, what were some of the struggles that he had, so what were some of the benefits that he got from working, how did it affect his public benefits. So it's one thing if me as a professional is talking to you and say, hey, this is what you can do. It's another thing if you have another individual who's part of the system talking to you about how they're making it work for themselves. Informed choice, again, we really worked on making sure that people understood their choices and what they could and couldn't do in the community. We redesigned our program designs and documents. Many of you are looking at that now because with the crosswalk, the fact that your service model, if you were providing 505 day programming, 510, 515, you're now you're going to be looking at the new service model with, what is it, 931, 932, 933. So there's only going to be 3 service models now. There's going to be day programming specific to persons with behavioral challenges, and day programming for persons with medical needs. And so if we're under the old system, you may need to move over to this new, go across the crosswalk. And in the process of doing that, you may need to redo your program designs. And we now have a service through Positive Purposes, another HCBS grant that could help you with that if you need that. And so talk with your regional center liaison, and they can help point you in that direction. We had 2 people become certified in benefits counseling. So as individuals go out and start working, it affects their SSI. It can affect their Medi-Cal. It can affect their if they're receiving SNAP benefits, other benefits that they're receiving. And in some cases, we've had situations where either the individual themselves or their family or others that are involved in their life have said, no, we don't want this person working because it's going to mess up their SSI. And there are ways that you can work and still receive your benefits. It may be reduced, but overall you will be making more money than you would have made if you were just on SSI. And SSI basically assures you a poverty lifestyle. And so if you really want to have more in your life, employment is a way to do that, and benefits counseling is a way to do that. So that is something you could, if you're interested in. Brandeis University has an online course that you can take, and then you take an exam, and you can get certified in becoming a benefits counselor, so you can help the people you're working with, making sure that their benefits are maintained to the maximum that they can do that under their personal situation. Another area that the Bakersfield ARC has expanded into recently is social and recreational services. So these are services that are outside of the program day, but provide people with an alternative to integrate into the community and be part of the greater community, to be involved with activities in the community. Valerie was telling me, I guess there's going to be an ice cream social this evening for persons who are involved with the Bakersfield ARC program. The group went to Paso Robles, to the coast this weekend. And so there's a number of things. And then there's a new program that's out there, if some of you are interested in, that recently got vendored by DDS, called Coordinated Career Pathways. And that is for young adults coming out of the high school system, people that have been involved with day programming during the last 5 years. There's some other things which really helps people to move into employment opportunities. So that's another vendorization that you can look at if you're at all interested in providing employment type services. So the part of this presentation today was on existing services that you can utilize to do that. So again, look at the rates, look at the description of the programs, and see if they work for your service model. Work with your administration, work with your managers, and see how people want to do that. And then finally, also make sure that you've got your clientele, their families, their community involved throughout the whole process, so that they're really an integral part of the direction and the changes that you make. Okay. Oops. Some of the challenges that you find. Transitioning workers with more serious disabilities from alternative workplaces into mainstream employment settings. So what we found was that some individuals who were under our old 14C program, the program that paid sub-minimum wage, had some challenges in integrating into a new program that paid them minimum wage, but the productivity was not up to what it would take to be earning minimum wage. So there were some individuals who were in the supported employment who, once all these changes were made, ended up when the team sat down with them, deciding they wanted to continue to receive their services from Bakersfield ARC, who then moved to day services. And some of them were not happy about having lost the paycheck, even though it was minimal. They really took pride in their work and in their paycheck, and developing the resources and the intensity of manpower and the time and the creativity to really mainstream employment settings for individuals is a challenge, and something that we constantly work at, and Bakersfield ARC is constantly working to become better at. And it really is one of the challenges that's out there. Other challenges are trying to be innovative in a system that's got lots of rules. So if you look at the Lanterman Act, it's like getting thicker and bigger every year. It gets bigger, larger, more rules. Regional center has got more rules, etc. And so how do you do innovative stuff when you've got a lot of different rules? How do you staff for all these changes? And what do you do if you've got a group that's going out in the community and your staff person calls in sick that morning, and they were the group has got, let's say, a 1-to-6 ratio. And you don't have necessarily the backup staff, or there's some other challenges that you have with all of that. Transportation can be a real challenge as you do more things in the community, both for you and for the individuals you serve. So if you're helping people get employment in the community, how are they getting to and from their employment? The Get Bus system is somewhat limited. Uber and Lyft are potentially available, but can be costly. And then other things. And then, like I said, mentioning earlier, how do you work with people to maintain the maximum benefits that they can receive, public benefits, while they're involved with these alternative services and changes to the services that they receive? And then finally, my last slide, what I'd like to see for the future is that all people living in settings of their choice, the people live where they want to live. Now, there's some real challenges to that, especially for folks who want to live in their own apartment, and based off of what you receive for SSI and what the cost of apartment living is. It can be a real challenge to find apartments that work for individuals or multiple individuals in living arrangements. Will work next to co-workers who are not disabled. I would like to see people working in settings where they're working with you and I rather than other individuals, being part of a group of individuals who are working at a work site as a group of individuals. Uh, Enjoy rich and varied lives with community members so that they're part of the community, and all kinds of different things. So someone who goes to the Tuesday evening a quilting class through North of the River Recreation Department as part of a group of quilters is part of is involved with community life and will participate in a wide array of integrated community environments. So people want to be out there and part of the community and not in sites where they're brought to by a bus, spend the day, then they're picked up by a bus, taken home again. And that's their integration. Although during the day they may go out on certain days, we want to make sure that we widen that array of opportunities for individuals. Okay, we're just about ending time. Any last questions, concerns? People wanting to challenge what I had to say or come up with an alternative to what I've been talking about? And again, make sure you write up 3 things that you learned today, submit those to Irene, and you can get continuing education for an hour and a half for today. Any last comments or questions? You can turn on your mic. Okay, with that then, I'm going to end the presentation and thank you for coming on today. There will be presentations again in September, one on mid-September and then one in later September. And starting in October, with the new grant, there will only be 1 presentation a month. The next month will be the last month where we do 2 presentations a month. And there will be some changes, and part of that is because more individuals have signed on for HCBS funding, and so more of it was distributed to other providers, and that's a good thing. All right, so you take care now, and we'll see you. Hopefully, see you soon. Bye bye.
Jeff.
Yeah.
Oh, I thought I heard somebody was trying to get on, but thank you, Jeff.
All right. Bye bye now.